This presentation will be examining healthcare inequality and barriers to healthcare among the LGBT population. What does LGBT mean? The L stands for lesbians, women who are attracted to other women. The G stands for gay, men who are attracted to other men. The B stands for bisexual, which is men or women who are attracted to both genders. The T stands for transgender, which refers to someone whose gender identity does not match the gender they were assigned at birth. So how many people identify as LGBT? In the UK, the Office for National Statistics have found that just over 1 million people identify as gay, lesbian or bisexual, which is about 2% of the population. However, these figures are thought to be lower than the actual numbers due to a low self-reporting rate, and the numbers do vary among age. Among people aged 16 to 24, 4% of the population identify as LGBT. This can be attributed to the legitimisation and acceptance of other sexual orientations in the last 50 years. There are no official figures on the number of transgender people in the UK, but it is usually estimated at around 300 to 500,000. The LGBT population faces various health inequality issues. LGBT people have higher levels of mental health problems, including an increased suicide risk, as well as increased rates of smoking and illicit drug use. As well as these risk factors, LGBT people are less likely to access healthcare. So why are they less likely to go to their doctor? The main reason, sadly, is previous poor treatment and negative attitudes among healthcare staff. A study conducted in Lancashire in 2015 found that 25% of LGBT people felt that their identification as LGBT negatively affects the way healthcare professionals treat them, and this rises to 42% for transgender people. Maybe because of this, over 50% of LGBT people are not out to their doctors. This can lead to people missing out on specialised healthcare resources and not receiving appropriate information or treatment, as well as incorrect assumptions potentially being made about their health. The study in Lancashire also highlighted a few important negative experiences from transgender people, including a GP who tried to conduct an inappropriate internal examination, a GP who refused to treat post-op complications, which resulted in the patient having to travel to Brighton for treatment, and a gynaecologist who refused to treat a post-operative transgender woman and told her it was an abuse of the service. The report also included some statistics regarding healthcare for lesbians. Shockingly, 19% of lesbians in Lancashire were told by their doctor that they did not need ever to have a smear test because of their sexuality. This is completely incorrect, and in fact lesbians have a higher rate of cervical cancer, so if anything it is even more important for them to have smear tests to catch it earlier. 8% of the lesbians surveyed also said that they had approached their GP regarding fertility, and they universally described the experience as being terrible. There are whole other areas of health inequality among LGBT people that I haven't touched on, because I wanted to focus on the experiences of LGBT people in Lancashire in 2015 so people can see it as a problem being faced here and now and something that will be affecting our patients once we graduate. I hope this presentation has helped inform everyone of the issues and hope that we can bear these things in mind once we are treating patients. Thank you.
Created using Powtoon.